cancer. As you know, this is a 21st and 20th century problem throughout the world, and it's becoming increasingly important in different parts of the world. Even the Sudan also suffered from this, and technology is needed for diagnosis, screening, and treatment and management. Last week we heard in the news about genome screening for an early detection of cancer. Dr. Babikir is a distinguished consultant histopathologist who will throw light on the management of cancer treatment. Dr. Babikir.
Thank you very much, Chairman. I'm going to start from the last point by my colleague, hope. So there is hope still in the world, in here and in my country. And one of the hopes that we are trying to make is to mobilize people to transfer knowledge and technology to their homelands, especially those who come to this side of the world and attain a lot of knowledge and experience. And in 2010, we have established Sudanese Medical Association in UK and Ireland, hoping that we could improve the health situation in our home country back in Sudan. And we work with the establishment because that's the only way to work in Sudan. We held 7 joint international conferences so far in Sudan, and 2 in the West, one in UK and one in Ireland. And the session that and training we have provided was attended by 3,900 people. Majority of them are post-medical graduates who are in training. Some of them also are medical students. And we have people helping us from here, either from the Sudanese diaspora who are working here at a senior consultant level, or some of the native British people. We've got about 20 British and Irish people who help us delivering these 7 conferences. The 7th Joint International Conference, which I'm going to give you a brief summary of what we have delivered there and what we have achieved, that was held in November last year. And the title was the Multidisciplinary Approach for Cancer Management. And those who are in the medical field, they will know that cancer is treated here by a team, not by a doctor. I mean, back home in Sudan, when cancer is diagnosed, they will start with one clinician, and that will cascade the whole reaction, sending the patient to investigations, to imaging, etc., and getting everything back. In UK here, we hold meetings, multidisciplinary team meetings, where people sit together, the surgeons, the physicians, the radiologists, the pathologists, nurses, etc., and they will discuss the holistic management of the patient. So we thought that is a useful thing to do, and we wanted to transfer this bit of knowledge to Sudan, and we designed this meeting. And the setup included pathologists like myself, radiologists, surgeons, oncologists, and also included some journalists to include the health education in regarding to cancer in Sudan. And the audience were all related to the medical profession in the relevant field to cancer. In Sudan, we have 3 oncology centers. One is in the capital in Khartoum. One is in the second largest city, which is Madani. It's about 100 miles south to Khartoum. And the third one is Shandi, which is north to Khartoum. And in 2013, this is the most updated statistic that we have had from the Ministry of Health. There were 9,131 patients treated in these 3 centers. And the commonest cancers are breast, prostate, and esophagus. So most of the cancer burden is treated in Khartoum. Many people, they travel from different states to come to Khartoum to get treatment. Those who are financially capable, they go abroad, and they, including coming to the West here. So this is not the total number of cancer cases in Sudan, but these are the ones who came to the medical attention. And this is just a table to show the various centers and frequencies. Unfortunately, that was in Arabic because that was in the statistics from Ministry of Health. So I could translate to you that these are the number of cancer cases in the 3 cancer centers. The first one on the right is the Khartoum Center, the middle is the Madani, and the one on the left is from Shandi. And we have discussed how to set a multidisciplinary approach, but before to do that, we have to fill the gaps. And in order to fill these gaps, we have achieved recommendations in 3 areas, 3 broad areas. Some of them are policy-related recommendations, and we have divided these into short-term and long-term recommendations. And number 2 are medical training and high medical education related recommendations. And number 3 is the charity and media related. So one of the recommendation that we made, and it is a very urgent and very difficult to sort, because in Sudan the philosophy of providing the health care is not clear. Is it based on the public sector or on a private sector? This is not very clear, especially in the field of cancer. I mean, primary health care, there is a lot of input from the public sector. But in cancer, because there is a very high demand on very sophisticated technology, so the private sector has got more hand than the public sector. And also, we think that the management of cancer is beyond the financial capability of majority of patients. And there should be some input from the health insurance. There is health insurance in Sudan who have very reasonable coverage, and that should be one of the priorities. This is one of the recommendations. And also we recommended that a committee to assess the current situation in the 3 oncology centers, and from that assessment, then a planning for further service to include extending the cancer services to at least the heads of the provinces or states. We've got about 15 or 16 states. Some of them are very remote from these 3 centers, and still they have cancer, because you know cancer doesn't have boundaries. So we thought that there should be at least an expansion of this service based on what is present on the 3 centers to make a local, some sort of local cancer services. There is an issue of the medical supplies also in the Federal Ministry of Health, and mainly in relation to, in relation to diagnostic facilities and imaging and the consumables related to pathological services. These are the recommendations in relation to policies, and also medical equipment is a big issue in Sudan. There is no central body who look after this medical equipment and deciding the criteria and specification, etc. So we made a recommendation on that because these are needed on the precision of the diagnostic abilities in Sudan. Currently also we've got a lot of political sanctions on Sudan as a country, mainly by the United States, but it's implemented by most of the European countries. So we think also we need this to be lifted so that that can help. And also there is local sanctions, inside sanctions on the used donated medical equipment from the West, which is also an issue because most of them are charitable equipment, and they ban them for no good reason, because Sudan is not a rich country that can afford buying very new equipment. The long-term policies is there is now a national program for cancer control, which is existing but is not very viable, and it needs a lot of partnership from charities. Especially there is a new charity who has also participated in that conference called Salah Wanasi Cancer Foundation, and linking with between the public sector and charity will help the issue of cancer. Also, we think that there should be a national fund to sponsor cancer from some services and some industries that are involved in cancer, like cigarette smoking and mining, etc. There should be like a tax from these sectors. One of the interesting things that in the whole Sudan there is no PET scanner. And PET scanner is very important for in all international protocols of cancer for their follow-up, etc. And it costs about $2 million to buy a good PET scanner. And funnily enough, there are some football players who are paid like $2 million just to come and play in Sudan. So this is a very important issue, and it needs to be sorted. We have an issue related to protocols. We don't have written protocols in relation to cancer, and in most diseases, I think in Sudan, that is a very sensitive area. It needs to be addressed urgently. And statistics, availability of diagnostic centers and diagnostic reagents, etc. We don't have cancer registry, and most of these statistics are taken from just local records collected manually. The cancer services should be decentralized, as I have said earlier, and we did some recommendations on private sectors, which mainly in the same field, and supporting introducing charities inside the health sector, and also health education for cancer by utilizing music, media, local languages, etc. Because there is a lot of lack of knowledge about cancer, and a patient who might have cancer will be just bedridden for years, and then they will die. They'll think that they have got a bad gene or whatever. So there should be an education about these things. And we jump to education in medical training and education and learning. And that is introduction of the multidisciplinary team approach, introducing some sort of care or nursing, like Macmillan Nurse here in UK, so that they can help people to ease the burden of cancer on them. And also we recommended that some new programs for cancer to be introduced, because there is a lot of shortage in radiographers and oncologists and physicists and pharmacists who have got knowledge about cancer. And the MD program in pathology now is taken over by SMSB, and this is a very good step. It used to be run by University of Khartoum since 1986 for more than 30 years, but now all the training is centralized, and that will help to include the pathology in the big projected planning for Sudan. Also encouraging the cancer research, and I think that's all.